Hi, my name is Paola, and I'm a stroke survivor with Dysexecutive Syndrome, and this is my story. During this video, I'm gonna talk about Dysexecutive Syndrome, how it affected my daily life, and how I'm dealing with it. But first, I want to start explaining what a stroke is. A stroke is the sudden death of some brain cells due to the lack of oxygen when the blood flow to the brain is lost by blockage or rupture of an artery to the brain. Worldwide, cerebrovascular accidents or strokes are the second leading cause of death and the third leading cause of disability. It's well known that strokes have several post-episode consequences, but as in my case, one of the most common ones is Dysexecutive Syndrome. When this occurs after a stroke, the prevalence rates range from 42.1% to 44.2% of the patients. As its name mentions, Dysexecutive syndrome is an impairment of executive functions, which involves attention, goal setting, planning, memory, action initiation and inhibition, social cognition, theory of mind, insight, and metacognition. 3 months ago, I had a stroke with a small central nervous system infarct, developing an acute dysexecutive syndrome, which was characterized in my case with difficulty in attention, concentration, and processing speed specifically. In some cases, it's common to find a memory impairment or just confusion, but in my case, I was a patient with dysexecutive syndrome reporting immediate difficulties with focus, concentration, and attention. My daily life was severely affected by this dysexecutive syndrome, and several areas were having trouble in my life. When I talk about my attention impairment, I remember I wasn't able to attend to instructions, I wasn't able to recognize any mistakes, to continue with activities I have already started, and I was always focusing on irrelevant details. And this was affecting my academic, social, and work life. My impairments with the other executive functions like speed processing, problem solving, or planning, I think you can imagine what kind of problems I had. I wasn't able to initiate a task, to plan a task, to have a good development at them, to organize, or even to create a plan to solve a problem. When I started with evaluation to create a treatment for my symptoms, my doctor said that the most important thing is that we work fast. Despite the fact that following stroke symptoms typically improve over the first 3 to 6 months of recovery, my doctor said that if my dysexecutive syndrome was not treated immediately, I wouldn't be able to return to the cognitive level I had before the stroke. My doctors wanted to make sure in which executive function I was having more impairment, so I took the behavioral assessment of dysexecutive syndrome test to clarify this. With this evaluation, my doctor decided to make a highly focused training protocol that was based on behavioral approaches and include tasks and specific routines for activities on my daily living, but also external compensatory systems reached by games and mental training. It's been 2.5 months since I started my rehabilitation cognitive treatment, but I've also been attending to social support groups with other people that have had strokes, and then I'm starting a psychological therapy to deal with the emotional pain and discomfort I'm feeling these days. Executive dysfunction is pretty serious, and I think I wouldn't be able to work it by myself.